Hello, I'm Dr. Meghan. I'm a board-certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this is really important because I actually prescribe these medications all the time. I actually talk to patients about their weight all the time. I've helped hundreds of patients lose weight, and I'm here to help you too. I couldn't keep everything the same because I shot past my weight goal. I was at 223 at 5'2". When I started in February 2024, I only got up to Zepbound 5 at the beginning of November. I was 133 and knew if I continued the same, I'd get too low. So I started spacing out my shot slowly by adding a day or two every other week. By the end of January, I was 117 and going to every 14 to 16 days. So I kept it going and I did 19 days next, and this time going by 21. I've seen people going 3 weeks and even a few going 4. So far, it had no side effects, perhaps because my dose is low. I've managed at this point to stop losing and stay within the range of 116 to 121. But at my age, I look gaunt and wouldn't mind gaining 10 pounds. I think it's low for me. I've added some calories and reducing exercise. Okay. Should I consider stopping the med and restarting in the future? Should I start to gain too much? My doctor is supportive in whatever I decide. I've made lifestyle changes. I eat better and I exercise. Okay. What a great question. So, first of all, congrats on all your success and all the important lifestyle changes that you have made. That's really important, regardless of the amount of weight that you have lost. But especially for somebody who's lost over 100 pounds, you really need to make sure that you are building that muscle mass, right? Because we don't want to lose that. We want to preserve it or we want to gain muscle. That's going to be really, really helpful for your energy levels, for your resting metabolic rate. It really, there's nothing it's not going to help with. So congrats on all that. This is a great illustration for people of what I think of as the super responders. So there are some people, I have some patients like this, who they start off on a little dose. That's it. That's all they need. They've lost all the weight. It really doesn't happen to that many people, but for the people it does happen to, it's really incredible. And so I have patients like this that have lost an incredible amount of weight on the very, very lowest dose. And so I do want to be careful that they don't overshoot the mark. Again, the goal is not to be malnourished or underweight at all. When I have a patient like this, we really don't have the research yet to back up like a protocol in this situation. So you're really just working with the patient and trying to figure out what's going to work best for them because we don't have studies to guide us yet. So for someone like that, first of all, I would definitely when I have patients like this, if they're losing weight too quickly or I'm worried they're going to overshoot the mark, I bump them down to the lowest, most effective dose. So if I had somebody who was on 7.5, I would bump them down to 5, or maybe 2.5. If I had someone on 5, I'd bump them down to 2.5. Then I'm definitely thinking about, extending that time of the dosing. So they're doing a shot every 10 days, 14 days. You really kind of have to play it by ear. If I have a patient who's able to stay in their ideal, goal weight range that we have for them, and they're taking a shot every 2 weeks, I don't have a problem with that because again, the end game is not the perfect interval between the shots. The end game is what's the weight that you feel comfortable at that's sustainable for you, and how can we use this medication to get somebody there. So if I had a patient who's really, really losing weight, still on the lowest dose, I'm definitely thinking about extending that interval and seeing where is the place where they're still going to get results. They're going to stay at a stable place. They're not going to have side effects, and they feel good. So thank you so much for sending that question in. I think it's a really good illustration of what some people are really trying to figure out right now. That's going to do it for today. Thank you so much for watching. As always, if you have a question afterwards, you can definitely leave it on this video. You can leave it on another video and I will add it to the list. Thank you so much for everybody who sent in a question already. They are so helpful and they really help everybody learn. So thank you so much for that. Also, if you're stuck and confused and wondering why you are not losing weight or you can't get yourself to exercise, you can definitely book a consult with me. I do work as a life coach for people around the world to help them on the non-medical issues with their weight loss as well. So I'll leave all that info down below. Thank you so much for watching, and please be well.